So now our next presentation is from our patient representative, Penny Weir, and she's really going to provide a perspective on her journey of living with inflammatory bowel disease. So Penny is actually a development coordinator with Crohn's and Colitis Canada, so she really helps provide education, patient services, and fundraising initiatives, including the Gutsy Walk, which is coming up in June. Penny was diagnosed with Crohn's disease at the age of 13. And after several years of experiencing symptoms. So again, some of those very early tools to help with diagnosis certainly would have come in handy, I'm sure. Since her diagnosis, Penny's journey living with IBD has led her to experiencing flare-ups, treatment decisions, and learning how to live with the disease, both in her professional and her personal life. So as a new mother and a strong advocate, she is passionate and determined to be a part of the generation who helps find cures for IBD. Please join me in welcoming Penny.
Hi. That's my little plug. So hi, I'm so happy to be here today sharing my story with all of you. At the question and answer period, please feel free. I'm very open about my journey. This is how we're going to make a difference. So as Ida was saying, I do work for Crohn's and Colitis Canada as a development coordinator, and for Gutsy Walk, that's on June the 5th in 60 locations, so there's one walk near you somewhere. So my story begins 20 years ago. This is me 20 years ago. I was 8 years old. I was not feeling all that well. My symptoms were pretty mild at first. Loss of appetite. I stopped eating things that I loved because they would cause me to spend a whole lot of time in the washroom, so popcorn and hamburgers and those kind of things all gone from my diet before we even really knew what was going on. I was losing weight. I couldn't gain weight no matter what we tried. I was vomiting, and then I was bleeding. So I was in the 3rd grade, calling home sick from school almost every day for a good period of time. I had pain and nausea, and it was hard for me to explain at that age what was going on to my parents. So this ended up taking me to various doctors without really any answer. We checked out my eyes, checked out my ears, they had just doctors that talked to me. We couldn't really figure out exactly what happened. So a few years later, things started to get a lot worse, and this started us down a longer journey of trying to get a diagnosis. So on a trip to New York City, my families visited museums and art galleries, and I pretty much saw the washrooms at all of those places. So my great-aunt Dolly, who was with us on that trip, had read an article in some magazine somewhere about IBD, and she gave it to my mom. And so this led my mom to the library when we got home and back to my family physician. I just have this memory of her laying books in front of the doctor. This is what my daughter has. These are her symptoms. And she was right. It was like a light bulb went off in my doctor's face. And I had that small bowel follow through and another test of some kind and a colonoscopy. And I have Crohn's disease. So by 1996, I was 13 years old. I had a diagnosis, a disease, and we'd seen a pediatric GI specialist here at MAC. So unfortunately, as most of you probably already know, a diagnosis is really only the beginning of a patient's journey. I was still experiencing symptoms like the abdominal pain and the washroom visits and the bloating and the blood and the nausea. The nausea is the worst thing for me. I couldn't put on a pound if I tried. I still have trouble with that. I struggled with that always. At that point, though, I weighed a shocking 89 pounds, and I'm pretty tall. So I endured several months of trial and error, medication, several rounds of steroids before things really evened out. And things did even out. They would be okay for a while, and then they would get worse again. I was on Pentasa and Dipentum and budesonide, and the list goes on from there. I tried so many medications, and of course that lovely prednisone that makes you a crazy person, or makes me a crazy person, before I ended up moving on to a biologic medication that I'm still taking today. So in the early stages of this process, I had a lack of trust that the pills really were important. Oh, sorry. This is me in 1996. Missed one. So you can see how skinny I got there. So I had a lack of trust that those pills really were important. I mean, I was a teenager. I was 13, 14. Didn't feel them working, whatever that means. And often the side effects to me were just worse than what I was already feeling, and so I wasn't very good at taking them. I'll be honest. I just dealt with the symptoms and tried to be as normal as I could. So I took a pill swallowing course to try and get past that fear of pills and choking and those chalky ones getting stuck. I ended up spending 5 days at Sick Kids in the eating disorder clinic where they really tried to figure out why I couldn't gain any weight and sent me home with a bit of a plan, a nutrition plan, which really did make a difference, even though that scared the crap out of me. No pun intended. But finding a medication was by far my greatest hurdle. And I can't say it's over. It just felt like I would take something, I would use it without a whole lot of difference, and for a couple of years before it stopped working completely, and then we move on to something else. So when we started the biologic and I started to feel pretty good, I was so grateful and so relieved. In a way I really can't explain. It was like we finally found something that's working. It's a tough process to determine what to take, which choice to choose, and when you're feeling just that horrible, which symptom you want them to fix first. I very much, as we moved into the adult clinic, I very much missed the days that my parents were making those decisions for me. And because to be given options and you're like, I don't know which one to choose. So I thought that high school was the toughest challenge. Here's me in grade 9. I was just diagnosed. I was dealing with this new disease. I was trying to figure out who I was with this. I was trying to figure out how to tell people what I had. University lengthy exams were the next. I couldn't make it through a 3-hour exam without needing a washroom. I couldn't party the way that some people could party. True problem. But as I age and as my life changes, so do my challenges. So 3 years ago, things got really bad. I kept telling everyone after my diagnosis that I had mild to moderate Crohn's disease. And I did that for about 13 years until I was throwing up every day. I was pretty much living on Ensure and all those lovely drinks, Boost and the PC1 and all those, when my team decided that I needed surgery and that medication just wasn't cutting it anymore. I had too much scar tissue. I had been complaining about throwing up and nausea for about 2 to 3 years by this time. But it took me that long to really get there, even in my own mind, that this was not something I just ate. And this was not just a bad tummy day. This might be something we could fix. So they booked me to meet a surgeon in October of 2012. And unfortunately, I did not make it to that date. By the time June 2012 rolled around, right around Gutsy Walk, I was getting through my days on Coca-Cola. It was the only thing, besides water, that I could keep down that at least gave me a little bit of sugar to keep going. I really wasn't even keeping the Ensure down. So it was at that point that I called my nurse practitioner, who I see in the back there, and I told her I was not going to make it to October. So I ended up in emergency surgery that August. They removed 18 inches of my small intestine, so I hear I still have lots. And they repaired 2 strictures, and they actually found a carcinoid tumor inside my appendix. Surprise! So the following October, I was readmitted with a leak in my anastomosis, or the surgical joint of your 2 pieces of intestine. I was in the hospital for another 2 weeks. Then in March 2013, I was admitted again for a month this time with a severe infection called peritonitis that hit me out of nowhere. Craziest pain I've ever felt in my life, and I've had a baby since then. I was going septic, which is honestly was my worst nightmare, and really, really scared me. So when I was finally sent home after 30 days, there I am in bed, I had a PICC line and an IV pump, and I carried an IV pump in a purse everywhere I went. I continued to get my antibiotics that way. So there's my buddy that hung out with me for a few weeks. This was by far my most frustrating, enlightening, and terrifying experience of my life. Eventually, I turned the metaphorical corner that doctors always talk about when you're in the hospital, and I got healthy enough to start my family. So there's my baby boy. So a year and a half ago, I guess now, I had a baby boy. I was lucky enough to have a very healthy pregnancy. But only 2 days after giving birth, my Crohn started to flare again. And now I had this tiny baby that needed me. So I lost 25 pounds a week after having Jacob, which might sound awesome to some, but for me, that is not a good thing. So I was able to get back on track, and I had a pretty good year with my little guy. Here I am getting an infusion while cuddling with him. I have a basket of toys in every washroom so he can play and be supervised. I'm now 32 years old. I have a full-time job that I love. I'm always and forever on a roller coaster of symptoms. Every 4 weeks I get my medication through IV. It's immune suppressing, so I'm susceptible to colds and flu and all those fun things. But all in all, things are pretty good. I take vitamin D, I get my B12 shots. I still maintain a low-fiber, low-residue diet because it's the first thing that's really sort of worked really well for me. I feel a little bit crazy because 1 week I'll eat something and the next week I absolutely can't eat that anymore. I really eat very, very white food, and chicken and potatoes is sort of where I live. I see my GI or my nurse practitioner every couple months, and my surgeon a few months between that. I have to have some of those awful tests that Dr. Marshall was talking about, and each test comes with its own disgusting drink, I might add. Looking to the future, here's my future. This is my family. My fiance and my little guy. I'm getting married this summer. I don't know what's coming next. I have both hope and fear for the future. I never know how long a flare will last. I don't know what symptoms every day will bring. But all in all, I'm really scared about how this is going to affect this adorable little guy. I don't want him to get this. I don't want to be away from him. And I am terrified of my increased risk of cancer. Those are my big fears right at the moment. But I'm working with Crohn's and Colitis Canada. We are doing a lot of awesome things to really make a difference, including, I've got to plug it one more time, our Gutsy Walk, June the 5th. I got to do it, Ida. 60 locations, so there's one near you. So thank you so much. And again, feel free to ask questions during the Q&A period.